So, today I'm going to be talking about depression and the relationship between depression and exercise. So, what is depression? It's a medical illness that negatively affects the way you think and feel and how you act. It involves constant feelings of sadness and loss of interest in previously enjoyed activities, and it causes impairments in a person's ability to function on a day to day basis. So, it's different from sadness in the way that it involves maintaining a sad or depressed mood on a day to day basis. Loss of interest or motivation, changes in appetite, so usually results in either weight loss or weight gain, hypersomnia or insomnia, lack of energy, constant fatigue, feelings of worthlessness or low self esteem, feelings of guilt, trouble thinking and concentrating, or thoughts of death and suicide. So, some risk factors would be family history of mental illness, so a genetic predisposition, low social status or income, childhood emotional or physical neglect/abuse, low self-esteem or perceived self-image, lack of social support, substance abuse, gender, so females are more likely to be depressed, and serious illnesses or chronic conditions. So some etiology. There are several causes linked to depression, the first being biochemistry. So with this, the frontal lobe of the brain may be less active. There's a smaller hippocampus generally in individuals who are depressed, and a chemical imbalance in the brain, so an imbalance in neurotransmitters in the brain. The four main neurotransmitters being acetylcholine, serotonin, dopamine, and norepinephrine. So how do these neurons communicate? Their structure and function, to begin with, is the neuron has a cell body and a tail-like structure called an axon, and each neuron is separated by a tiny space called a synapse. So the neurotransmitter, aka the chemical message, will travel across the synapse into the next neuron to relay a message. So neurons communicate by exchanging neurotransmitters across synapses in order to get a particular message throughout the brain, resulting in a psychological or physiological response. So what happens if there's a deficiency in one of those neurotransmitters? When communicating chemical messages, there needs to be a perfect matching signal, meaning there needs to be the perfect amount of a neurotransmitter in order for that neurotransmitter to cross the synapse and reach the receptor, therefore activating the receptor in order for the message to get through. So deficiency in one of these neurotransmitters that play a role in depression will inhibit the action or role of these neurotransmitters, resulting in symptoms that define depression. So the second cause of depression could be due to genetics. So about 50% of depression cases are due to genetics, while the other 50% are due to psychological or physical factors. So someone with a parent or a sibling with depression is 2 to 3 times more likely of developing depression compared to someone with no family history. And there's no one depression gene. It's normally a combination of genes from the mother and the father that contribute to depression. The third possible cause of depression is personality. So there are personality traits that can be linked to mental illnesses, especially depression. The first being neuroticism, so experiencing negative emotions, fear, sadness, guilt, anger, envy. Low levels of extroversion, disinhibition, so someone who expresses the traits of being impulsive, lacking social norms, disagreeableness, and are unconscientious. And lastly, a possible cause of depression could be due to environmental factors, so this includes foods we eat, relationships, so child neglect and abuse, social isolation, long-term stress, traumatic life events, chronic health issues, environmental pollutants, and possibly electrical pollution. So some statistics about depression is that it's the leading cause of disability worldwide for ages 15 to 45. It affects 322 million, or 16% of people worldwide each year. 75% of people with mental disorders will be untreated, with about 1 million people taking their lives every year as a result. Anxiety disorders are often accompanied by depression, vice versa, and they are the most common mental disorders worldwide. 1 in 10 adults in the US suffer from depression, and affects more than 16.1 million adults, or 6.7% of the US population a year, in individuals 18 and older. So this is just a graph showing some 2019 statistics on depression in different age ranges. So you can see that the older one gets, the less depressed they seem to be, or they have less severe depression. And then this graph shows men and women differences in depression across cultures. So in every culture shown here, women are a lot more likely to be depressed. And some treatment for depression. So the first form of treatment are medications, so antidepressants. There are different types of antidepressants depending on the person and their situation. There are selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, and mixed reuptake inhibitors. So these all treat depression in different forms. The second form of treatment is called electroconvulsive therapy, or ECT. There is a brief electrical current applied to the brain with this treatment, and it results in temporary seizures. And usually 6 to 10 outpatient treatments are required with this type of treatment. There's psychosocial treatment, so this involves cognitive behavioral therapy. So this addresses cognitive errors in thinking and also includes behavioral components, including behavioral activation. And there's also interpersonal psychotherapy, so this focuses to improve problematic relationships. So the exercise effect on depression. There is research that shows that exercise is an effective treatment for depression and can work as well as antidepressants for some people. Benefits of regular exercise include protection against heart disease, protection against diabetes, lowered blood pressure, improved sleep, and high-intensity exercises relief endorphins, the feel-good chemical, or commonly referred to the runner's high, and prolonged low-intensity exercise release neurotrophic proteins. So this is the key component in helping prevent, decrease, and sometimes even treat depression as opposed to taking medication. So how do these neurotrophic proteins work? Prolonged low-intensity exercise causes the release of neurotrophic proteins, also known as growth factors, and the release of these proteins cause nerve cells to grow and make new connections. In addition, recent studies have shown that the release of these proteins can result in neurogenesis, meaning new cells or new nerve cells are actually created. And the outcome of nerve cell growth and new connections means improved brain function, which is what would make one feel better after routinely exercising. People who are depressed generally have a smaller hippocampus compared to individuals who are not depressed. The hippocampus is a cortical region of the brain that regulates motivation, emotion, learning, and memory, and these are all the functions that are typically downgraded in depressed individuals. So exercise supports new nerve cells and connection, therefore alleviating depression and depressive symptoms. So the case study, this is a client who is a 32-year-old woman who presented symptoms of depression. She said that she had crying spells and just feels sad all the time for no particular reason. The client also presented with insomnia and stated that she normally lies awake, worrying and thinking about worst-case scenarios. She's denied suicidal thoughts and ideations, however, the client has accumulated an additional condition due to her depression. This client has an increased appetite due to her depression, causing her to gain 45 pounds in the last year and a half. And in addition, a lack of sleep might contribute to her weight gain due to the hormone ghrelin. So this hormone spikes when individuals are sleep deprived, and it increases their appetite. So at a height of 5 foot 3 inches and a weight of 195 pounds, the client has a body mass index of 34 kilograms per meters, putting her in the obese category. And in addition to physiological risks, this client is now at risk for physicality risks such as type 2 diabetes and heart disease. So at present, she is sedentary with a resting heart rate of 82 beats per minute, a resting blood pressure of 145 over 85, which is slightly high, and her LDL cholesterol is at 125 milligrams per deciliter, which is also slightly elevated. So in order to ensure that this patient is in good standing health, both physically and psychologically, she will need to follow an exercise regimen, accompanied by weekly therapy sessions. So exercise testing should be initiated because this patient is obese, and here we did the Bruce treadmill protocol test. So this test was initiated to test the client's cardiovascular endurance and determine the client's maximal oxygen uptake, or VO2 max. And the results of this test concluded a maximum heart rate of 163 beats a minute, a blood pressure reading of 195/90, and her RP was at 14. So for this client's exercise prescription, she should be doing a warm-up, 5 to 10 minutes of walking on a treadmill or some kind of light work to get her blood circulating to the muscles and elevate her heart rate slightly. And it should also involve a cool down at the end of the workout. So again, 5 to 10 minutes of light exercise, so it could be walking, and this will allow the body to reach a homeostatic equilibrium, and it will bring down the client's heart rate. So aerobic exercise should be done equal to or greater than 5 days a week at an intensity that's moderate, so 40 to 60% of her heart rate reserve. So in this individual, it would be 126 to 146 beats per minute. Time, it would be 30 minutes a day, 150 minutes a week. Type, prolonged rhythmic activities using large muscle groups, so this could be walking, cycling, swimming. Regarding resistance training, the frequency should be done 2 to 3 days a week at an intensity of 60 to 70% of her 1 RM. She should be doing 2 to 4 sets of 8 to 12 repetitions of each exercise, and resistance machines and or free weights would be what she would do to work out. Flexibility frequency should be greater than or equal to 2 to 3 days a week, at an intensity of stretching to the point of feeling uncomfortable or slight tightness. She should hold these static stretches for about 10 to 30 seconds for 2 to 4 repetitions of each exercise. And the type of flexibility exercises she would be doing is static and dynamic. So in conclusion, exercise can prevent or improve both physical and psychological problems and symptoms. In addition to improving physical health problems such as high blood pressure, high cholesterol, and diabetes, exercise also can improve or prevent psychological problems such as depression. Exercise has psychological benefits like improving mood, reduced stress or better ability to cope with stress, improved self-esteem, pride in accomplishment, increased energy, and increased satisfaction of health. So regular exercise creates an improved quality of life overall and all aspects of health.